Alright, hold the beans. I hate, I gotta find like a way that I can like save this comment or something because open again for free HIV because of um, this typing it every time is for the birds. Yeah, like I need to find if I like can save it or something. 4439 to make an appointment. Okay, everybody, we will be covering Mpox today. I gotta bring this up because. Okay. Hello, everybody. My name is Corey, and I use he, him, his pronouns. So, of course, the Community Health Department with Whitman-Walker Healthcare has expanded this outreach efforts to social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So, again, today we will be covering Mpox. Okay, so Mpox is a virus, zoonosis, a virus transmitted from humans to humans from animals, which with symptoms similar to those seen in the past in smallpox patients. Although it's clinically less severe, with the eradication of smallpox in 1980 and subsequent um, cessation, of smallpox vaccination, monkeypox or mpox has emerged as the most important um, orthopox virus for public health. Mpox primarily occurs in Central and West Africa, often in proximities to tropical rainforests, and has been increasingly appearing in urban areas, of course, like the United States of America. Animal hosts include a range of rodents and non-human primates. So this is just some key facts about Mpox. Vaccines used during the smallpox eradication also provide protection against monkeypox or Mpox. Um, Newer vaccines have been developed, of which has been approved for prevention of Mpox. Mpox is caused by the monkeypox virus. It is a member of the orthopox virus genus in the family of pox, um, Pox viridae. Mpox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Severe cases can occur in recent times. Um, the case fatality ratio has been around 3 to 6%. Mpox is transmitted through humans to humans through close contact with infected persons or animals, or with material contaminated by the virus. So it's very similar to the smallpox virus. Mpox virus is transmitted from one person to another by close contact with lesions, body fluids, respiratory droplets, and contaminated materials such as bedding. Mpox is a viral zoonotic disease that occurs primarily in tropical rainforest areas, Central and West Africa, and is occasionally exported to other regions. So that's why we're starting to have the outbreak around, and in the Americas and things of that nature, is because of it has somehow made its way to the area. So signs and symptoms: the incubation period of Mpox is usually 6 to 13 days, but it can range from 5 to 21 days. The infection can be divided into two periods: the invasion period, which lasts between 1 and 5 days, characterized by fever, intense headache, um, lymphadenopathy, is with this, which is the swelling of the lymph nodes, back pain, myalgia, intense um, fatigue, and then the second one is so the skin eruption, usually which lasts 1 to 3 days of appearance of after the appearance of the fever. The rash tends to be more concentrated in the face and extremities rather than on the trunk of the body. Like so, basically anywhere that's like on the outside of your body, but instead of like this is your trunk area, like your chest, torso, stomach. Um, it affects the face in 95% of cases, in the palms of hands, and the soles of feet. Also affected are or sometimes which affects is the oral mucosal membranes, which is in 70% of cases in the and genitalia. The rash evolves sequent from lesions to papulas, so basically like little bumps, vestules, pustules filled with yellow discharge, and crust, which dries up and falls off. So it's basically like little small lesion bumps that pus, and the pus dries up and falls off. The number of lesions vary from a few to several thousand. In severe cases, lesions can be there until large sections of the skin kind of like come off. Mpox is usually a self-limited disease with the symptoms lasting only 2 to 4 weeks. So if you do get this, it can last up to 2 to 4 weeks. Severe cases occur more commonly among children, and it's related to an extent of virus exposure. Patient health statuses, and the nature can like can vary from the nature of complications. Underlying immune deficiencies may lead to worse outcomes. Of course, I just said that. Like like so, if there's things that kind of already going on, it can make the symptoms worse. Like anything else, if you have a compromised immune system, it is definitely recommended for you to get vaccinated for everything. Although vaccination against smallpox was protected in the past, today's persons younger than 40 to 50 years of age, depending on the country, may be more susceptible to mpox due to cessation of the smallpox vaccination. Campaigns globally are after eradication of the disease. Complications of mpox can include secondary infections, sepsis, infection of the cornea, bronchial pneumonia. The extent to which the extent to which asymptomatic infection may occur is unknown. The case fatality ratio for Mpox has historically ranged from 0 to 11% in the general population and has been higher among children. In recent times, the case fatality ratio has been around 3 to 6%. So vaccination against smallpox was demonstrated through several observational studies to be about 85% effective in preventing mpox. So that's the vaccination um, that we have available is the same vaccine that is available for smallpox. So mpox in DC in the community, and this is a little bit about community response. Mpox cases in DC has grown eightfold in the past week, and the cases are getting more severe, according to health officials. As of Tuesday, there are 58 known cases of the viral disease in the district. City health officials reported 7 people had the virus last Tuesday. DC is among the regions of the country with the most mpox cases, according to the Centers of Disease Control and Prevention. So, according to CDC, DC is among the regions of the country with the most mpox cases. Some of the last patients to contract the virus have had to seek care at hospitals, official says, and we have had individuals in DC who have been hospitalized for pain control. This is not something like where it is bumps on your body. These are very painful rashes and lesions on your body, said Patricia Ashley with the DC Department of Health. No, Patrick Ashley. Health officials said that they are using the Genos vaccine, which is the FDA licensed vaccine for the prevention of smallpox and now Mpox, of course. There's currently a limited supply of Genos. However, there aren't yet enough doses to keep up with the demand, officials said. So there is not enough of this vaccine as of yet to keep up with the demand. So hopefully they will be able to do something about that. Like if they start creating more, and just getting it out there just in case if this does turn into a situation where everybody needs it. Well, yeah, that's basically it. That's Mpox in a nutshell for right now. Of course, more things are going to be coming out. They're going to be monitoring the numbers. I definitely would say that it would be good for you to for people just to just monitor the numbers and kind of just see where everything is, because nobody wants to catch something that they can prevent. But of course, before we go, we want to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You have definitely taken a really important step to preventing yourself, your loved ones, and your communities from illness. Multiple variants have soared all across the world, and it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker has the COVID-19 vaccine available. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, for DC residents, you can find more information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at COVID link. Oh, so DFS, there is the vaccine there is not. So basically, they are using a vaccine that prevents smallpox and mpox. So, but there is not. However, it isn't enough to keep doses to keep up with demands that that's what officials are saying. So there's not enough of the vaccine to like distribute to everybody right now. So it is, but if you want to look it up, it's JYNNEOS. That's the name of the vaccine that they said that health officials are using. So I don't know who is like getting the vaccine first. I don't know if it's people that are um, so Mpox cases in DC have grown eightfold in the past week. And cases are getting more severe. According to health officials, as of Tuesday, there are 58 known cases of the virus in the district. And DC is among the regions of the country with the most Mpox cases, according to the Centers of Disease Control and Prevention. So, DC has was one of the highest. For Virginia residents, learn more about the Virginia distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're looking for an appointment, please continue to follow CDC's guidelines. If you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you consider getting the vaccine, discuss COVID precautionary measures. on the COVID booster. What's the intel for fall boosters? I'm gonna do a live. I'll do a live about that. Probably next week. I'll put that on my schedule to do a live about that, so people will be able to know. Because as of right now, I haven't. I don't know. I can try to look it up really quickly. Fall COVID boosters 2022. Hmm. Let's see what this says. COVID-19 update. FDA recommends inclusion of Omicron BA 4-5 component of COVID-19 vaccine nation booster. FDA, the FDA. Oh yeah, so the FDA has approved and authorized for emergency use. So it's not one of the for as of right now, it's not one of those boosters that everyone's going to get. I think they have just yeah, on Tuesday, the USA Food and Drug Administration independent experts on the vaccine and related biology met to publicly discuss whether to change the current vaccine strands composition of vaccines booster is necessary for fall and winter season. Yeah, so it just says that it's going to just be used in emergency use. If that answers your question. Yeah, but bye everybody. We'll get off here. I will see you all on Friday for the group live. Everybody stay safe this week and stay away from Mpox.